So I'm Dr. Mike Arnold. I'm a pediatric pathologist at Children's Hospital Colorado and a professor of pathology at the University of Colorado. Thank you so much for joining for this live Instagram, where I'm going to give an update on my survival guide to pediatric tumors. So if you saw this lecture before, if you've seen pediatric specimens before, you know that a lot of them can look really, really similar. So here's 4 different pictures of 4 different tumors, and you may look at that and just say it's all blue. That's fine. Hopefully by the end of this lecture, you'll have some idea of how to tell those things apart, and maybe you won't just see it as a sea of blue. But when you see a sea of blue, you're going to want to learn to swim. So we're going to talk about how to identify the H&E features that are going to help you distinguish these tumors. I'm really going to focus as much as possible on H&E. We're going to talk about some of the clinical features of each of these small round blue cell tumors, and hopefully we're going to understand a little bit about tests that are going to help separate them. So how are you going to tell these apart? In addition to your eye, what are you going to do to confirm your impression? So the mnemonic I like for this, and I'm going to get myself out of the way for a second, the mnemonic I like for this is learn to swim. Lymphoma, Ewing sarcoma, Alveolar Rhabdomyosarcoma, Neuroblastoma, Synovial sarcoma, INI1 lost tumors, and the M or miscellaneous for MPNST and a few other things. And then if you see me give this lecture recently, you'll know that I put another M in here now to specifically call out some of the molecularly defined entities in the current WHO, and we'll get to those in just a moment. So once you have a good list of things that you want to rule in or rule out, the first thing is to gather all the clues, and clinical features are probably the most important thing that you're going to have. It's certainly the first piece of information you're going to have. You're going to have the patient age, the location, and hopefully you might have some laboratory data that would be helpful. But it's kind of like real estate. It's about age and location. That's going to tell you what's most common and what's most likely, and you're going to work from there. Next, you're going to look at histology. We're going to look at cell shape. We're going to look for pleomorphism. We're going to look at the cytoplasm. We're going to look at vascular patterns. We're going to look at necrosis. All those histologic things are going to help us narrow in on a differential. And then lastly, confirmatory tests. Immunohistochemistry is a first line. But of course, you're going to see things like FISH and RT-PCR, and more recently, next-generation sequencing. And I think sometime in the future, you'll also see methylation profiling become an important piece of the puzzle for trying to figure out what some of these tumors are. So here's my list of key clinical features for these tumors. I'm going to share all these I'll share the recording on YouTube, and I'll also share a couple of these pictures, the slides on social media as well. So don't feel the need to grab screen grabs, but feel free if you'd like, but I will definitely put these out. And we'll talk about all these in a little bit of detail as we go. We're also going to talk about pathology features. So there's a lot of specific histology things that are going to make you think about certain things. You know, if you see foamy cytoplasm, maybe it's rhabdomyosarcoma. If you see rhabdoid cytology, you might think about rhabdomyosarcoma. And again, we'll go through all these as well. And then lastly, just to summarize a few of the molecular features, there's obviously some really testable information here about translocations and fusions, and this is updated a little bit to reflect the current WHO classification.